Yeah.
Did you guys have any star matches what I see any buildings or anything?
I haven't heard of it.
Okay, we didn't have any report from Crawford County, but I thought I'd check.
Pam emailed me, but I haven't talked to him yet. I don't know.
Because
I'll text him real quick.
I know there were some tree damage and things like that, but I didn't know if you had any buildings.
I don't know. I'll see if we can't find out.
Okay, I just thought I'd check while I was in there.
Amanda, I just want to talk to you about like there's a comment underneath that says these numbers are fluctuating frequently. Something like that. The quarantine, not cancellation.
Yes, we
The
are.
quarantine is all up and down the front.
No.
So we could do that on the.
I can do that.
Wednesday. It's a little star underneath, you know, it's just quarantine, the numbers in quarantine fluctuate frequently, and the given numbers.
When I built it, I didn't make
Something
it.
like that, so people see that, and it's sad. Yeah.
What I did is I hired
Figure it out,
people
it's
like
up and down
all
every
that's
day.
connected. That makes any sense.
The isolation, I
I'm
think, is
gonna
very.
do the same thing right here. It's all about water. So I have more water available to me.
Yeah. Current.
But
Yeah, got their break on, that's good. Just a lot of little stuff.
I don't know.
You ready?
Yes, sir.
All right. Call this meeting of the Crawford County Commission to order this first day of September 2020. Please join me for the Pledge of Allegiance. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, begin with the approval of the minutes from last meeting last week.
Mr. Chairman, I'll move we approve the minutes from the previous meeting.
Second, move on to signing of the motions.
There's several motions from the last meeting to sign. The first motion is 20-351, that the consent agenda be approved.
Mhm.
The next motion is 20-352, to approve local health officer order number 2 to go into effect at noon on August 28, 2020, and authorize the vice chairman to sign. The next motion is 20-353, to take a 5-minute recess. The next motion is 20-354, to open the public hearing on the Crawford County fiscal year 2021 budget. The next motion is 20-355, to close the public hearing on the Crawford County fiscal year 2021 budget. The next motion is 20-356, to adopt the fiscal year 2021 Crawford County budget as published. motion is 20-357 to approve a county credit card with a credit limit of $2,500 for County Attorney Raina Prober. Next motion is 20-358 to approve the transfer of the funds received from KDOT from the Special Bridge Fund to the Road and Bridge Equipment Reserve Fund. The next motion is 20-359 to approve the physician consultant services contract between Community Health Center of Southeast Kansas Incorporated and the County Commission of Crawford County, Kansas, and authorize the vice chairman to sign.
Took a while.
The next motion is 20-360 to approve the proposal for a 2019 Chevrolet Tahoe in the amount of $37,179 from En Route Emergency Vehicle Outfitters. And the last motion is 20-361 to recess this open session and go into a closed executive session for a period of not more than 15 minutes to discuss non-elected personnel and to include the Board of County Commissioners and County Councilor James Emerson, and to reconvene by 12:05 p.m.
Thank you, Don.
Thank you, Your Honor. Appreciate it.
All right. Well, our health officers ready?
Good morning, Commissioners.
Morning.
I know last week we had intended, no, there you go. We intended to just really do this on Fridays. We've had some market increases in case numbers, and so we wanted to bring you up to date. We were also going to ask for executive session here in a few minutes to discuss some other things. Currently, we have 328
308 in isolation.
308. We have 308 in isolation, and we have over 1,000 in quarantine within the county currently. The isolation number is moving pretty quickly. We actually are up to the point now that we have overwhelmed our health department for case tracing, and we are asking KDHE's help in managing the tracing through their facilities as far as managing the contacts and quarantine. We are still sending out our own isolation order to all positives, so that's the legal order within the county. But we need their help to manage the case tracing so we can initiate the quarantines throughout the community. And we have 6 heavy nurses, and we have to call the positives. Oh, we have 8.
We hired the 3, so we have
we have 8 epi nurses. Calling each one of those isolation cases every day to evaluate symptoms and release them from isolation, that in itself is overwhelming. We have situations essentially in each school, which also requires a lot of their work as we manage that. That's mostly quarantine. And then just the day-to-day activities going forward. So they needed help. I agree with that. Dr. Bean agrees with that. And so they're pushing some of that on to KDHE. There is some challenges in that our folks are able to react a little quicker and understand our local community. The state level doesn't necessarily understand that. There's also a communication flow. It takes a little bit more time, where before we had it in-house, we could make in-house decisions a little quicker. We're able to get information out to the public a little quicker. Now there's a delay piece in that. I don't think that in itself significantly impacts the community, other than us presenting information to you, which is why we're giving you estimates on quarantine versus hard numbers that we had before. The isolation number is right, though, and we will continue to present that. We still have our data from our local community that we're following and will continue to follow and present. Right now, we do not have what we would say is a significant medical impact. I'll let Dr. Bean go through those numbers, and we'll discuss that. We do have some medical impact, though.
So at Via Christi, we currently have 5 positives admitted. We have 1 PUI. None of the positives are currently on the ventilator. And at this point, capacity is good. Girard has 1 PUI, so 1 person being tested, no positives. Their capacity is good, although a little bit strapped on staffing, but as far as actual bed count, they're good. PSU currently has 131 in isolation, so some of that is overlap with the isolation numbers for the health department, but they have someone working with the health department that is doing a lot of the follow-up with the students and all of that, similar to what the epi nurses are doing. And they are currently getting about probably 20 to 30 positives per day as far as testing.
At PSU?
So those are the healthcare. We are seeing a little bit of an impact in the long-term care facilities. One in particular is really struggling with staffing due to the number of staff that are either out positive or out quarantined. And so that is the big challenge. We have had a positive who is now admitted, and so that is certainly impacting what long-term care facilities are having to do as far as testing, as far as isolating residents, and definitely impactful in that area.
And, you know, last week, we had gone to the most restrictive state for all the long-term care facilities. That turns out, I think, to be timely. And we are hopeful that through that move last week and the aggressive approach that the long-term care facilities have with regard to evaluating and managing COVID cases, that we won't have a significant spread. But it is something that we're watching for sure.
That's it for the numbers.
So the numbers are challenging. We have concerns in our school systems and at PSU and in the community with why we're not closing more, why we haven't shut down the schools. One of the questions that we have is in the school gating criteria that we presented to you previously. There's 5 categories. We are absolutely in the red in 3 of the 5 categories. And 2 of the 5 categories. We're essentially still in the green. The green category is student absenteeism and the community impact, local capacity impact. The red categories, 2-week percent positive, the county incidents, that's the cases per 100,000, and the trend in the county, we're absolutely in the red. We look at the data related to where it's at in the community and its impact and what pieces of the community that it's impacting in an effort to decide where we're going to recommend our impacts to reduce the spread of COVID-19. Last week was a result of that look as we just made discussions with regard to bars, restaurants, and drinking establishments. We did not recommend changes in the school specifically as far as going to hybrid or remote because that's not the population affected. We have, I think, 5 total cases, is that right, of positives within the school systems. And that may be a little bit more.
Actually, so one school system has 5. One school system has 1, another school system has 3. So it's small numbers throughout the school systems.
Now, understand that that's students and staff. And so I think our total number of students is 5 or less and the rest are staff. And what we do see is the 18 to 25-year-old group is a significant number of our positives. Just the PSU isolation number itself, even though it crosses over, that's 131 of those over 300 cases. And there's more in the community. What we don't see and what we haven't seen in the schools, in the protected mitigated environment, is we have not seen a person-to-person spread within the school. So a positive case identified in the school during the school day, using the mitigation strategies that we have put in place, we have not seen a person-to-person spread. That's good. We are still doing quarantine based on the state guidelines and we'll continue that. We will not change that. And quite frankly, we cannot change that. Meaning if you're within 6 feet for 10 minutes, irregardless of the type of mask that you have on, unless it's the full PPE, N95, etc., you will be quarantined. And that's right, that's appropriate. But thankfully, we haven't seen person-to-person spread in the schools. We do have concerns with the students outside of school. And there are other mitigation strategies that we have recommended to each of the schools. And it's a recommendation only, but it's based on our concerns for spread. And the recommendations specifically with the spectator sports, which seems to have caused the greatest consternation throughout the communities we put in place. Now, we made those recommendations as a result of the superintendents asking us for what our recommendation would be based on current data science and common sense, so that they would have something that would be universal through the county, and then they could enact, because the different counties around the state that the schools interact with during sports play all have different rules. So they're trying to come up with something that they can utilize here locally and with their teams as they go out to other areas. And we think that's an appropriate ask, and we developed a set of guideline recommendations that most are adopting.
So, Doctor, and of course I'm referring to the outdoor sports.
Yes.
It was brought up to us yesterday about some kind of, I don't know what you call it, a rule or a recommendation, because that's exactly what it was a recommendation. It wasn't a mandate. And, I've heard a lot of questions about if we wear masks to the football games, and tried to distance ourselves being outdoors, if that would help, if that helps, slow the spread. But I guess my point is we made the recommendation, but ultimately it's up to each an individual school and school board
to vote on that regulation, whether it's mandated by the school or not.
That, at this point, that is correct. And so, the two things with that. Absolutely. The bottom line answer is yes, it's a recommendation, and each school
At
will
this
decide,
point.
or each district, yes, will decide if they want to put those in place. There are some caveats there. The mask mandate is in place in our community. That's really not up for discussion. That was put in place by the governor. The governor's school orders would indicate that the masks are required, so that's not you, not us, that is from the state. I will tell you, we agree with it 100%. But the other recommendations that we put in place and the limits on number of spectators is the greatest area of consternation. Is a recommendation based on what we've seen throughout the state as we tried to decide what was going to be beneficial, appropriate, and hopefully help decrease the spread within the parents and grandparents.
And in collaboration with the superintendents, because they know what their capacities are in their bleachers.
Sure.
And as you say, you know, if you can mask and you can socially distance, the challenge that they're facing is if there isn't some sort of a limit, then they are not going to be able to meet the distancing. They're not going to be able to keep it from being a packed stadium. And ultimately, they are concerned about jeopardizing the ability to continue with having spectators and having sports. And so by putting a little bit of limit on it from the beginning, as we are seeing rising increases in our community, in order to have a protected normal and allow our students continue to participate and allow families to be able to continue come in person and watch their athletes participate, starting off with a limitation was an ask from the superintendents to be able to help
So
manage
we were
this.
asked that from the superintendents.
Right. And
And-
so we looked at the plan throughout the state to try to come up with a reasonable way for them to manage their stadiums and schools and protect the public safety.
And have an expectation for out-of-county schools, because they are struggling with the teams that they could be playing and wanting to be able to protect their players and their spectators for the home team going out or for those players coming in.
We have some schools that are protecting their players by doing remote learning with their players.
Mhm.
And that is a perfectly viable and valid option.
Mhm.
But then we mix up all their parents with a whole bunch of people that we don't know,
Sure.
or they don't know, and they don't know the COVID status. The kids can still be quarantined because the parents are getting sick with COVID-19, right? That's the bottom line. And so, and the stand population is not the younger, healthier kids that are playing in the field. The stand population is parents and grandparents who are more likely to have a significant disease related to COVID-19, significant health concerns, morbidity, illness, and death. So it's a recommendation. It's based on our best estimate of the science and data currently. We do recommend they follow it, but each school board has the option to elect to do some of those things.
Sure. Well, I could tell you from my part of the country, we go to Columbus and play this Friday.
Yep.
It's a tiny stadium. And as far as I know, there's nothing in place in Cherokee County. So, we're going to send, a large portion of our town over there. And I'm sure we'll go to the game because, as you know, in Frontenac, we love football.
Right.
And but we also, want to be safe about it. But I was concerned yesterday when I'd heard that because I'd never heard that before, and I talked to Rebecca, and she did inform me that it was a recommendation and why we recommended it, and I understand that. But ultimately, the school boards in each district has some say-so as well. So I didn't want to make it sound like we're forcing anything at this point.
We're
down
not
their
at this
throats.
point. Now, I will tell you, if we find, just like in certain populations that we've found right now, that we have a significant outbreak, we're going to come back to you and present that.
Absolutely, and that's understandable.
And so, the other thing, with the school gating criteria, because we're looking at the data so closely each day and moving forward and its impact on the community, we haven't recommended closing the schools or going to all remote learning. The school gating criteria, just so everybody understands, is a recommendation from the Kansas Department of Education. But I want to also make clear at the very bottom of the recommendations, it does say that they are recommendations subject to change by actions of federal, state, county, or local authorities. So there's a misunderstanding in the community that this is an absolute. Also kind of it's also a recommendation, but it is something that we can impact because we are the local authorities.
Right.
That would make that decision. So far, the governor hasn't issued a change in her orders as far as more stringent going forward. That could happen in the future depending on the case rate. And understand, Kansas is increasing 600 cases a day throughout our state.
So it's not just our corner of the...
It's not just our corner. But we're certainly in their radar. Between Cherokee and Crawford County, we are certainly in their radar as far as our incidence and trend in case or daily case rate. And so we want the schools to be able to teach our children safely. We want the schools to be able to participate.
And that's first
in
and
sports.
foremost.
Yeah, absolutely,
You
first
know.
and foremost. We want our schools to be able to participate in sports safely. We want our spectators to be able to watch our kids safely, right? We want to be able to continue on with what we're doing, but we want to do it safely, and that's where our recommendations come from. It's not to impede or impair any one group. It's to preserve the safety of the public overall. Our bottom line mission at the health department is safety of the public overall. Safety and health of the public. And so our recommendations are based on that. So we're going to talk with each of the school boards if they want. Many of them are just adopting this as rule. Some have questions. We understand. We're available for that. We'll work with them, and hopefully we can continue to keep a safe environment for our kids, continue sports play and spectators, and move forward from there.
Understandable. Appreciate everything you do.
I did have a question came in on the by email during the live webcast here, but they were wondering, how long is it taking to receive tests back, and do we have rapid testing capability in the county?
So our testing capability has been adequate. There is some rapid testing available in the county. There's also send-out testing, which is what we historically have been doing, and our turnaround time has improved significantly. So there was a time when we went through 10 days, sometimes getting test results back from some of the outside labs. But we are now seeing about 24 to 48 hour turnaround time for the majority of our tests that are being sent out. So it is much more significantly improved from what it had been.
And quite frankly, 24 to 48 hours is a very reasonable time, especially since the majority of our testing is symptomatic testing. You have 3 days after your symptoms go away, if you don't have COVID-19, before you can get back into any activities. So we're well within that time frame of getting that answer to the person and making sure that the community is safe. So 24 to 48 hour turnaround, totally appropriate and effective as healthcare providers, what we do for a living, and helping us manage our making decisions and caring for our patients. 10 days, we weren't happy with.
No, not at all.
Not at all. So, yeah, and that's been solid for weeks now, and improving actually throughout the community.
And access to testing is very good. Through all of the organizations that are doing testing, we have same-day testing available as far as being able to come in and get tested through many of the different entities.
Yeah, essentially all the entities, I mean, the main healthcare entities, you can do same-day testing. I mean, there's always an option. Not same-day results, let me be clear, same-day testing.
As far as, you talked about the uptick in numbers, do we know how this weekend went?
I can tell you. Got a bunch of little sticky notes here. So over the weekend, we had, on Friday, we had 65 new cases, Saturday 30, Sunday 24. Yesterday 43, and this morning already 28 on the facts. So, and then
Rebecca, when you say the facts, is the facts coming from
they fax them in, the
to
positive.
KDHE or?
Actually, on our fax machine, different entities like labs, medical facilities, CHC, urgent care, they fax those results into us, and most of them also fax them to KDHE. When we get them, then we fax them to KDHE. KDHE puts them in the computer system, and then that's how we start
And
investigating.
at that time, that's when it's counted?
Yeah, so that's why it takes a few days sometimes for the state map to match what we're getting it on the fax. Because to be quite honest, I mean, they're bogged down too with all of
Sure.
these statewide numbers coming in. Now, I know that the EPI system has, we got an email that they've just hired 25 new data entry folks up at KDHE on EPI. So just to give an idea, some of our EPI nurses have 30, some have 40, and some have 50 cases they're currently working on. So those are positives. So when you have to call each one of those every day, and for at least 10 days, some more than 10 days. So for at least the next 10 to 14 days, we'll be trying to get those finished out, and then we'll be able to take more on as those, fall off. But the other thing we'd like to focus on heavily is our schools, and KDHE will be sending us numbers for Pitt State and local schools, so that we'll still be in the loop in all of that, because they ask that question during the investigation. Every person gets asked that regardless of how old they are. If they go to school anywhere or where they work, unless it's a toddler, of course, then you ask what daycare they go to. So anyway, it'll take a little while for them to get back to a point. We just really want to be able to control and help the schools as much as possible, because we want to keep them open and going as, to the best capacity that they can. So we're just going to be forwarding those for now, until we can kind of get a better grip on it.
As far as the schools go, I had gotten a question. What are the reporting criteria to the public as far as the number of?
There's no state mandate or anything like that they have to report to the public. Most of them are reporting to their parents that, like if an exposure or positive, they have a press release that they send out or a letter. My son goes to Pittsburgh High School, so I mean, they have letters that they email out, but they're not required to report by law. If someone is named as a contact, then the health department will call that person and let them know that they need to quarantine
that's where the actual state regulation comes in, is if you're named as a contact or a positive, of course, then we call and you have to isolate legally. You have anything?
Yeah, the schools, I think, are taking the appropriate step in notifying their parents of information that they know.
They keep going to sleep.
I can only speak for the county. I talked to the dispatchers who came over there and they didn't get any phone calls, but I can't speak for Pittsburgh or any of the other municipalities.
Now, we are going to be on a call today to talk with law enforcement to kind of go through where we're at on that. We have a tendency to get a lot of email in the health department, and personally, if there's issues, and I didn't have any. In fact, a few of the facilities are closed, and I believe that's a staffing issue.
And I said, I think some of the bars are already closing, or I know one that's already closing at 11 or something like that already. They were doing that before this, so.
I spoke with a couple of the bar owners, and
Yeah.
that's what they were doing, as well as a couple of them
Chose not to even open up last weekend, so.
So Rebecca's got it set up for us to have a Zoom meeting today at 2 o'clock, so we invited law enforcement, prosecutors, and everybody to try to get on that.
And if you would like to be on that, I can forward it
Okay.
What
Thank you.
time is that?
to you.
Yeah, it may be interesting.
Yeah.
That would be helpful, I think.
Okay.
Because so one of the other things I'd gotten was the thing we talked about on Friday, which was the house parties, which will be the obvious, where the traffic will go if they feel like they can't go out or whatever, and I'd gotten at least.
The house part is concern for all of us. We're trying to figure this out. And these guys at nighttime, can't be going around patrolling for house parties. We need people to take the personal responsibility to not move from the bars to an unrestricted area, take off all their masks and start checking out of each other's mugs, which is what got us in this in the first place. But as far as them running around looking for house parties, that they're protecting the public safety, and I don't know that that's necessarily in their wheelhouse. Although I think if they saw a large gathering of kids, it might pique their interest. Just for all the other laws.
As any time.
Yeah, all the other laws that they might be breaking at that time. And so there is discussion, and we do want to talk with you guys more regarding the hours of operation for the bars. We put in place the hour restriction partly because it has been something that has been carried forward throughout the state for a variety of reasons in different locales. One of the unintended consequences of that, though, maybe we're moving from a protected environment where we know that the social distancing is appropriate and the seat to serve is appropriate to an outside unprotected environment. So we want to talk with you more about that. And we want to consider that as we go forward. And while we're sort of changing our mind, we're sort of backpedaling, I'm not so sure that it's really that. We're looking at the data going forward and making sure that's a reasonable adjustment based on what we're doing. And so as we look at these cases, I think it's important that we look at everything we're doing each day to see what the positive or negative impact is and adjust appropriately based on what we're seeing, so that our decisions are reasonable and effective and not ineffective because of over encumbrance or that it's not affecting the right group. And so,
not just to have restrictions,
right.
but that they are thoughtful and they are relevant.
That's exactly what I was trying to say, but she did it in one sentence, so I appreciate that. So we are going to look at that, and we do want to talk with you guys more about that. I think if we can get a few minutes with you here shortly.
Would you like to have an executive session?
I think so, if we could. I think it's open what we're going to be talking about, but I think we'd like to be able to sit down in front of you and discuss what we're seeing in that more privileged setting.
How long would you need, Doctor?
15 minutes. We always say 10 and then we're
Pushed?
Yeah, so let's do
Could this be in
15.
June?
With the health officers,
Not looking.
All right.
myself, Dr. Bean, Rebecca Adamson, Micah Ealing, and Samantha Garrett.
I will move that we go into executive session for 15 minutes. To Commissioners, Council, our health directors, Dr. Bean, Dr. Stebbins, Rebecca, and Mike Ealing.
And Samantha Garrett.
And who?
Samantha.
And Samantha. 15 minutes under non-elected personnel.
To discuss health orders.
Yes.
Second.
Clearly.
Took everybody, huh?
Yeah.
I don't know what it is with these mics. I mean, they
go to sleep.
They go to sleep, and there were people talking, but they were all back from the microphone about 3 feet or so. And it,
Have you thought about hanging a mic in the back?
yeah, well, we talked about that originally, but then we worried we'd be picking up too much crowd noise. And I don't know, we're gonna have, part of our
If you
fun.
can shut it off.
Part of our funding, we're gonna kind of have probably.
You know,
come in and read.
someone, because it wouldn't cost you anything, they're not selling anything, but Ladonna Harvey, I agree with it.
Uh-huh.
Right before this, they redid all their AV for training purposes. And she'd really be a good one. She's not selling anything.
Yeah.
And knows the challenges to keep it updated.
That's
There's
LaDonna.
someone there.
Hartman.
LaDonna Hartman.
Okay, yeah. Doctor, sick. Go back.
Okay, go ahead.
What do you think?
Oh, I don't know. Something new every day.
Is that true?
If it was there, I'd drink it.
guys work with any other groups on, any other entities on Spark?
Bourbon County,
Bourbon
I think that we probably could have had several. I've had a
I
couple
think so,
calls that
yeah.
just said,
Yeah, a lot of-
our hands are full.
A lot of county clerks were looking for some help.
Yeah.
Because it kind of got thrust on them and they were wanting help. But some of them, some depending on population, some of them only had maybe $1 million
Right.
or even less, some of those smaller counties.
Yeah, I think, what county was that? It was a small county, Chautauqua,
Yeah.
and I stepped through it, and I said, you really don't need us. You can pay us, but you don't need us for what you're doing.
Yeah. Well, now, there's not that many businesses or nonprofits and things, yeah.
So it'll be interesting to see how, especially when the state calls back, how I don't know how the state's handling all this in every county.
Well, I mean, originally it sounded like it was up to the county
Right.
to approve it. And then they were on the hook though.
Right.
If there was a
Right.
problem down the road, and then of course that guidance kept changing about every week or 2 weeks.
About every 48 hours.
Yeah, somebody had a thought that came to them.
Somebody in DC, they make a cup of coffee, change your guidance, go home, come back, make a cup of coffee.
Yeah.
Change guidance, go home.
That's, at least it was on their mind all the time.
Oh, absolutely. Absolutely.
They didn't just throw it out there and forget about it. Thought about it maybe a little more than they needed to. So, yeah. Yeah, the little job that just so
Yeah, that's not.
we had, I dealt with her, she kept calling me 2 or 3 times because of a friend that had an issue from Katie maybe that's an issue or something. Yeah, you call law enforcement.
Call law enforcement.
Yeah, that's not what the county clerk said. Now, there is a statute still on the books, if the sheriff resigns or something happens to him and there is no undersheriff, the county clerk becomes the sheriff.
Oh, that's
Until
nice.
somebody gets appointed, and actually, a good friend of mine who used to be Bourbon County clerk years ago, she had that happen to her, where she was technically in charge of
Oh, my
the
goodness.
sheriff department for about a month. I called her and gave her a hard time about it,
A month too long, yeah. So, Morgan, is it real school, or they have to do
They just started in-person classes again.
good?
We need to reach out so they can check it out. Oh.
Where is she at?
She's at Mid-American Nazarene
Oh, yeah, they're in Olathe.
in nursing school, yeah.
That's a good idea, though.
And they started,
Nazarene's got a lot of money.
and they started clinical system.
Where's she do it now?
Children's nursing and Olathe Medical Center, which is where she works, is Olathe Medical Center.
Is that, do you have more than one child?
I have two.
Okay, is that your youngest or?
Yeah.
Okay. Now, you're finally getting them almost.
She's been gone for 3 years, it's been great.
Oh, yeah. Ours are, well, older, but, I mean, well, Boone, Dylan's 25, we got,
has Asperger's, and he does really good. He works at daycare in Trondheim, and likes it. He really loves that. He took early childhood development classes and got his bachelor's degree. But then his older brother Boone has got kids, and they live now. But gosh, we spend a lot of time. Seems like we spent a lot of the weekend there moving, and have about a month in between leaving one house and getting possession of another house, and we're storing furniture and in our shed and anywhere we can find a spot for it. And it's kind of, you never totally, you're always on call, kind of, like.
Yeah, my garage has a bunch of her furniture. We moved her. We get rid of it.
We just got that new shed, it's a lot bigger and everything, and got our stuff in it and had a bunch of extra room, and then like, oh yeah, we've cordoned off a big corner of it, we got a bunch of stuff stacked in it now. It got filled up in a hurry, but it'll be gone, well, by the time we do, we'll be over there painting, and he's got some tile work he wants done. I've got a wet saw and do some tile work when somebody needs it anyway, and things like that. So it'll probably be a month and a half or 2 months before they're actually moving into it. Do we have any grandkids? No.
They're not married.
Oh, yeah.
No plans, no prospects.
Yeah. Our oldest, they've got, his wife already had a child. She was 5 when they got married, and then they've got 2 little ones. She's 11 now, and then Barry's almost 4, and he just turned 2. And, LaDonna's retired teacher. She watches them about 2 or 3 days a week, and the other grandma the other 2 or 3 days, which is fun. Although she just had the one yesterday. Evie had fallen Sunday night, and she has a huge knot right in the middle of her forehead. So Kayla stayed home so she could, supposed to kind of monitor her every hour, and check her vitals and stuff. So LaDonna just had Barry. She's like, it's like, this is such a great day, because Barry's pretty easy to manage. He likes to be close to you, interacting with you, talking to you and stuff. And Evie, she just wants to go and, you'll find her back in the bedroom on top of the bed. We got where we shut every door in the hallway so she can't go into all the rooms.
She'll figure out how to open them soon.
Yeah, she will. Hopefully she'll be, and climb up on stuff. She's up on top of the end table or whatever. You come in there, she's like she's waiting for you to come in and find her there.
That's why she has music.
Yeah, that's true. And they like to fight, over toys and people's attention and all that kind of stuff. I was like, this was a really nice day. He says that, watching them both, it just kind of wears you out. But
So are we next on the agenda?
yeah, as soon as this is over. I mean, we really didn't have you on the agenda. We had you, for the work session. And but
I think that they'll want you guys to go ahead, because they just want to approve that, whatever the round two funding as discussed. Something that won't take but 5 minutes. But that's- The health department stuff is kind of taking over the first half an hour to hour of our meetings. It seems like.
Sorry, I thought I had that for you.
Y'all made it back?
It's kind of cool. Yes, it is. Okay, so it sounds like the health officers will be reviewing the order and coming back to us Friday or sooner with
So
recommended changes.
we are going to recommend some changes with regard to the health order, specifically the closing times of businesses to allow for the businesses to close per their local ordinances at those times. We won't affect their closing time specifically. We also want to ensure that we have the appropriate adjustments for the event centers to allow them to continue to operate in a standard that they had previously with the appropriate mitigation strategies in place. So we'll add that into the health order to allow them to continue to function, but with approved mitigation. And we'll give them a little time for that to be effective. A couple things that we did want to just restate to ensure that the word gets out. One, with respect to the games, spectator sports, and moving about the community, we ask that the community at large takes the personal responsibility of applying their own mitigation each and every day, and no matter where they're going. So if we have players and families traveling to districts that have no mitigation strategies in place, we ask that you protect yourself. Wear the mask, use the hand sanitizer, social distance yourself from those that you don't know, right? The masks are effective. The mitigation strategies are effective, and we can prevent bringing that back to our community. So go if that's what you want to do, but please do it safely so that we don't have to see you in our other environment or worse. There's one other thing I was going to say, I don't know what it was. We will continue to monitor our data going forward. We are making an adjustment. We think that's an appropriate adjustment based on what we're seeing. And we're trying to ensure that we're keeping the public safe in the areas that we have found to be unsafe. But we don't want to have an unintended impact of something that we didn't foresee. And so we are open to looking at that each and every day. And we hope and appreciate the understanding of the public.
I did have one more question related to the increased numbers this weekend. Do we have a sense of the point of origin of those? Like, was it similar to what we had seen in the uptick of bars and
It's
gatherings?
primarily the 18 to 25 age group.
So was that simply carryover from previous? I mean, or?
That's the contact of the contact. That's why we're doing the quarantine. So we've got to break that chain. The only way to break that chain is stop any potential movement of those that may be infected. And that's really what the quarantine is for. It's not a punishment, it's not to make it harder, we understand.
And we recognize that it's difficult because it is people that feel well and are yet asked to stay home for 2 weeks. And that is really difficult, but that's what stops the chain.
And why it's so important for people to take the mitigation steps in the first place so that we don't have to quarantine 1,000 people.
Right. Which will be 1,000 plus. It's 1,000 plus.
Today, I'm sure it is.
Yeah, 1,000 plus.
That's
So-
1 out of 40 people in the county.
Right.
That are quarantined, like that. That's insane.
Right, we agree. We also ask for the public's understanding as we try to do our job, and specifically with the health department. And it's not a happy call when we call you and say that you've been identified as a contact and you're now under quarantine. Understand that these people that are making those calls are doing it with your best interest and the public's best interest in mind. We understand it's emotionally challenging to find out that you can't do what you want to do for the next 2 weeks. It changes plans. But understand, it's not them trying to do something bad to you. It's them trying to do their job to protect the public. And it's hard. It's hard on them, it's hard on you. But understand, when they're talking to you, they're doing it overall for the best interest of everybody. And just give them a break. You know, they're getting yelled at every day for doing their job and doing it right and keeping everybody safe. And so, understanding, please.
All right.
Okay.
Doctors, you had mentioned earlier that you're willing to meet with the different school boards if asked.
Yes.
That's on the table.
Yes,
So
we
we'll make
have
that-
one meeting already set up for the 14th unless it gets moved to sooner
Okay.
in your district.
All right. Well, we appreciate what you do because it's not easy. They're not easy decisions that have to be made, but you know, it's for everyone's protection. So, thank you.
I appreciate it.
Thank you, guys. Anything else on public health? All right. Thank you all.
We asked about a person to help us with data collection. Did we get that?
Not yet.
We want to keep that on the table to help us have a person with data collection so we can help manage the significant amount of data that's coming in. It helps us in decision making. We just are out of people. And so, again, if there is somebody else in the county that we could cross over to our service for a while, not forever, we would like you to consider that still.
Sure.
Appreciate it.
All right. Thank you again. Okay. Moving on. Mike, do you want to
Sure.
do your thing? I'll not forget you this time.
No, that's all right. Round two, we've just completed round two of the business and not-for-profit under Spark. And for those that are listening, that is Federal CARES Act money that's being administered at the county level. Round two, we had 59 applications of businesses or not-for-profits based on the formula that was established by the task force. And there were $137,750 in total requests. We have about $121,000 available in this round. So my recommendation would be to approve the grantees as presented with the addition of a $500 grant for the Live Well Crawford County organization.
Yes, we discussed this in the work session. I think that's probably a good idea. Jeremy, do you have any
Yeah,
questions?
no, the ones that we had discussed excluding, there were clear reasons
Yes.
for doing so, of a variety.
Yes.
And I think, yeah, I don't have any questions about the setup. That looks good. I'm glad that we captured so many additional
Absolutely.
businesses with
And,
this.
with a little bit of luck, I'm hopeful that we might even be able to have a round 3, albeit it would be a much smaller focused, but to pick up those last remaining businesses that for one reason or another missed these 2, or they continue to be hit with the impact of COVID at one level or another. So.
Do we have an expected timeline on hearing back from the state? Has there been any?
Anytime, really anytime. My understanding that the state is contacting counties individually with questions regarding the county applications. I really don't anticipate that there's anything in ours that would raise a lot of red flags. So sometime between now and the 15th, so in the next 2 weeks. And then as a reminder, as soon as we get the approval, we'll be sending out all the recipients memorandum of understanding that requests some key information that you will need to administer. We'll process those, and we are going to get checks out just as soon as we can, because we have had some requests. You know, when are these funds going to be available? So we're moving just as quickly as we can, knowing that all funds need to be spent by December. Let me rephrase that. We would like that all funds be spent by November.
Fair enough. Yeah, so we're not sending any back.
Right.
Well, Mr. Chairman, if there's no questions, I'll approve as presented for round 2 with the addition of Live Well.
Second.
Thank you.
Thank
All
you.
right. Thank you, guys. Thanks again for your continued administration of this. It would not have been possible without you.
Thank you.
I imagine that the word pleasure there is, a little,
I've had worse times.
not like having a tooth pulled. but,
Yeah, absolutely.
All right. Thanks again.
Thank you.
Okay, so we have a public hearing scheduled for today on the Crawford County Fire Districts numbers 1, 2, 3, and 4 for their 2021 budgets. I'll move that we open the hearing.
Second?
Is there anyone here to provide input on the proposed budgets for fire districts 1, 2, 3, and 4 for the 2021 year?
The only reason I'm here is to thank you guys for your support.
Could you come up to the,
And
state your name? We know you, but just for the record.
I'm Mike Ryan, Baker Township Fire Department, and I'm just here today to thank you for your support and see if anyone had any questions. And it doesn't look like there's a whole lot of people left, so. But we've had a busy few weeks. Hopefully it'll slow down a little bit, but talked to Jeremy 2 weeks ago, was it now? And I got a board meeting this next Tuesday, and I think we'll get that all taken care of, making some changes to our budget and the way we spend our money, but I think all that'll be good and go forward.
Awesome.
So, since there's nobody else, I just want to thank you guys, and I asked Jim, I wanted to know if we had any damage in the county from the storm. I don't think we had any turned into Pam, so.
So I texted Bob Grants, who's over our county buildings, and he told me that he hasn't heard of any damage.
Other than some trees.
Some trees down, right.
There's a couple $100,000 trees.
Yeah, I was looking at these expensive trees on the lawn.
Oh, man.
All right, well, guys, I appreciate it.
Well, thank you, Mike.
Thanks,
We
Mike.
appreciate
Yeah.
that. Well, Mr. Chairman, seeing no comment, I'll move we close the hearing.
Second. All right, well, seeing no commentary, on the proposed budgets for the fire districts, I will move to approve them.
Second.
Okay, moving on. I think
They
we're
want you
in.
guys to sign.
Yeah, here you go.
Top of the front.
Right.
A couple of those, and I'll keep those on file.
Thanks, guys.
Thank you, Mike.
Thanks, Mike.
See you, Mike.
Public Health did have one more question.
Oh, okay.
Sorry.
We had our intention was to review kind of the role of the health officers in September. I mean, that was kind of from the very beginning. And we thought it might be prudent just to have a work session this Friday if we could, just to kind of map out and
If
plan
we
the steps
could
going
wait
forward.
until Commissioner Blair is back.
Yeah.
so
Okay,
the
would that
three
be
of us-
better?
That would be better, yeah.
Okay.
And when will he be back?
I think next Tuesday.
Next
Next
Tuesday?
week, although
We won't
Well,
meet
we'll have it.
Tuesday.
I was gonna say, are we gonna meet because
Probably
it's
not be a
Labor
week
Day?
from Friday then.
Probably
So
not.
next Friday would be better.
Yep,
Okay, all right.
If we can get on at 9 for, not this Friday, the next
a
Friday.
week from Friday,
Work
yes.
session.
Should
For
be
a work
fine,
session.
yeah.
9
Okay.
a.m. session.
Yep.
Okay, all right.
Okay.
Thank you.
Thank you, guys.
Appreciate it.
Okay, moving on to new business. Dawn?
I had the clerk's report for August. That's the summary of the changes in spending. I'll also give you a copy of the report. The clerk's report is, the statutory function that we have to go through every month. Basically, a regurgitating of all the expenses for each month. Did have some significant changes between July and August. And this is that what we call a cheat sheet or whatever, our summary of changes. The ambulance service was up about $6,700, which they'd seen last month in July a decrease in overtime, and that's kind of bounced back up in August, and as well as some spending on medical supplies. Community corrections had some additional spending. They installed a couple of monitoring cameras in their office. General fund was up quite a bit there, but and I knew with our primary election in August, we would have a lot of payroll, a lot of spending connected with that, but also we paid our full year of audit fees. We got our audit for 2019 and a bill for those fees is kind of a partial billing for the Spark administration fees from Greenbush there. And then sheriff had some training expenditures. It was, other than that, that made most of the changes there. Down on our, it's that PHAP grant. It was down a little bit, which they had some overtime and payroll taxes that they paid in July that we did not see in August, which reduced their spending in August from July. Same way for the health department. They had a lot, especially the health officers, and some overtime that in connection with COVID-19 work they caught up for and trying to get that all kind of squared away before we cut off our Spark applications. In Health and Family, just a little bit, they have an ad that they put in names and numbers each year. It's a kind of a, once a year expenditure. It's about $2,000. That Fund 123 is new. It's just for some COVID-19 items, and it was, Jim might help me a little bit with some of the background, but Janice Godeke and Rick Pfeiffer had kind of put away some funds that were supposed to be kind of a starting point to pay for items in case of a pandemic or a disaster in the county. And that money was deposited into this fund, and they've had some of the expenses that have been incurred here the last couple of months. Ads for those epi nurses and other items that came up that were not really one department or another, but they fall under COVID-19. And most of that is covered, will be covered under reimbursements we get back from, or some of that, the epi nurses would be the direct aid application to as part of the Spark funding. Their road bridge was up quite a bit. They had recycled asphalt wrap, they call it, cold mix that they had a big run on. I'm not exactly sure where that went, but that was $94,000. The consolidated 911, it's some big bills for software. I think it's stuff that they've started purchasing over the last couple of years. It's a global technology software. It's made by the Tyler Technologies, same people who write our Encode software, and they paid for some of the voice software, and then actually the 911, kind of the mapping software that is part of that. That employee benefit spending was down a little bit, a little over $15,000, but in July it was up about that same amount. It was for those health savings account deposits that we made in July, but didn't occur again in August. So in August you see a reduction. Fire District number 1 at about $5,000 that over what they normally spend, but they made radio purchases in August totaling almost $11,000. So they were down in other areas. The other fire districts were pretty much, not much different than their usual monthly expenses. That JJRJ 11th Judicial District Fund was down about $6,700. They had one of their employees was reclassified to a different part of their operation, and that that actually we don't track here. It's a grant-funded program, and that $5,500 in the payroll taxes associated with it came up to right at the $6,700. Tourism and convention, the Commissioner Visitors Bureau basically was up quite a bit. They made their quarterly payment on the PSU event facility out there, which is a part of our transient guest tax. 1% out of the 6% is earmarked for that event facility to help pay for the upkeep and kind of administration over there. So they made that payment in August. Then they also put together, I guess, their new visitor's guide for the new year. It totaled about $24,500 for those. Sewer District number 4 was down a lot, but it was up a lot in July. Had some big, several grinder pumps that had failed and had to be repaired. And thankfully, we didn't repeat that in August as well. So they're down between July and August by that amount. Then the mental health payroll was down quite a bit, which some of their seasonal programs were going offline, and they have a reduction in staff because of that. It is most of the really significant, changes anyway, kind of.
All right.
Summarize there.
All right.
Thanks, Don. So we'll need to do a roll call vote to approve I so move that we.
Move that we accept the county clerk's report as presented.
Second.
Okay, and then on roll call vote, Commissioner Moody.
Aye.
Commissioner Johnson.
Aye.
Commissioner Webb.
All right.
Thank you for that. Yeah, if I can get you to sign.
Oh, yeah.
Sign one copy of that, please, the actual report. Yeah, that's great.
All right.
Thank you. That's all I had for new business.
Okay. Jim.
I'm needing to request an executive session for 15 minutes under attorney-client privilege. And this was regarding a road issue.
Okay.
And that's all I have, sir.
Okay. Tom.
Mr. Chairman, I'd ask for a 10-minute executive session under non-elected personnel pertaining what appears to be some insubordination.
Okay. Anything else?
No, sir.
Okay. I don't think that I had any new business. Okay. Old business. Don?
I might just run it by you that, and I think I've mentioned this to you before, we have been told that we'll receive a couple of secure ballot drop boxes from the state, and their anticipated delivery date is like mid to late October, about the middle of October, which is I think October the 14th will be the first day for the general election that we're allowed to mail out ballots by mail. And so then usually within 4 or 5 days, you start seeing a return on those. And we would like to have those ballot boxes out and installed so that you know, people could use those. And I mean, I think it's a great program where, would allow us to, people to do that without, having to include postage on those envelopes, and they'll know they're secure and in our hands and not necessarily in the mail stream somewhere between their, their post office box and our post office box. So I would like to work with Mr. Gorens, your, you know, facilities guy, to kind of help me with getting those installed, figure out where would be a good place for those. I'd like to have one here and one at the Judicial Center, and that would give us, kind of help us cover the county at least somewhat, and give people someplace where they don't have to drive, you know, 10 or 15 miles or 20 miles to use those if they want to. And then anyway, I'd like to work with him on kind of figuring out where would be a good place, those facilities. I think it'd be good to have it somewhere where people could just drive up and put them out their window into that. They have kind of a, you know, a receptacle thing that you slip those in, they go down in the box, and then you have to have a key to get the bottom part open to pull anything back out of it. So anyway,
Yeah, I don't think that's a problem.
okay, and I had said, I'd sent Hippie, Mr. Durant's a copy of the email that had kind of the specs for that box, so that he, you know, just told him, said, hey, I'd like to work with you on setting this up, but you guys are his boss, so I think I need to,
Yeah, it's not a
you
problem.
guys are okay
Yep.
with that too. I don't want to be commandeering your employee there, but, yeah, it'll be, I think, a great thing to have. I hope that, I'm a little unsure about it, if we want to make them so that we could uninstall them when we're not doing an election. You know, do we want to leave them out there year round, but they're only used, you know, for a 2 or 3 week period, you know, maybe twice, 3 times a year? Or would we make it so that we could, you know, unbolt them from the concrete and pull them back off or whatever? You know, that's one of those things that I've been kind of throwing around in my head, because I mean, you want them to be securely anchored, things like
Right.
that. But anyway, we've got some time to bounce it around, but I want to get figured out where they need to go, and make sure if we need to pour a little block of concrete to stick them into, we can get that done ahead of time. And
Yeah, we'll leave that up to you and Robert.
okay, thank you very much, appreciate it.
All right. Jim?
I have none, sir.
Tom?
No, sir.
I do not have any. So I will, do we want to do
Let's do
Jim's
Jim's.
first? Okay, I move that we'll go into executive session for 15 minutes under attorney-client privilege regarding roads.
The road issue.
Okay, commissioners and council.
Second.
Wherever is fine. All right.
Send you that information on those boxes?
I will.
Okay.
Yeah, and we have, you were talking about how many followers the sheriff has on his Facebook page.
Yes.
Yeah,
That's something.
we need to work on that for our elections page.
Okay, so you guys have your own page then?
We have an elections
Okay.
Facebook page, we have one for the fiscal office as well.
that's a question with everyone.
Yeah,
Like
so
how
I-
secure they're gonna be.
And we want to make sure, well, and the sooner we kind of let people know that, the more secure they feel when they're making that option to get a ballot by mail. And, we want to, if that's what they want to do, we want them to be able to do that and feel confident that it's gonna, once they get that ballot voted, they can put it in there and it's, like it's in our hands. That, that's gonna, we'll have to come up with, I don't know, Secretary of State's office is gonna come up with any kind of information to have there at the box, but I think it would be good for us to have some kind of signage there to make sure to tell people, make sure, did you sign the outside of the envelope, put your address on it, because we have to have that for it to be counted. If not, you can open this little flap that kind of hides your signature on the envelope, but you can, and we do that here, when people come into the office, we can feel it. If they're not sure, we'll ask them, did you sign your envelope? And we instruct them to go and do it the same way. And if they're not sure, hey, you can open this little flap, and here's the place where you sign it. You can get it done now. Because that's, you don't like getting those and then not being signed. And I mean, we do chase down a lot of those. If we have, there's a day or two before the deadline, we'll call them and if we have a phone number for them, we tell them that we need to get those signed. And I've gone to people's houses and had them signed in because they couldn't get here, things like that. Usually 3 or 4 days before the election, I'll have 5 or 6 of those that all people go around and do that. So it's, but it's nice to have it there when they're getting ready to deposit it. You can hopefully avoid a few of those situations. Yeah.
Did you guys already start posting that video? I know you said you wanted to bring it up with the commissioners.
Oh, yeah.
I didn't know if that was something I'm able to share yet, or if
Yeah,
that's been planned first.
I mean, really, I probably should have them be aware of it. I wonder if I don't know if they really think Bruce needs to be here or not to see that. I can see some of them, if they're concerned about the security about maybe seeing that as being controversial or whatever. But I think it's a good video and a good, hopefully a good message for people to hear. Because I think there's a lot of people just, especially now, that's a really smart option. Yeah, maybe I'll bring that up. Yeah, I can play it for them if they want to. Try to go find that. Email Sarah. So I can do that for them. It's a good idea, because that'd be good to share on those Facebook pages as well. And I know Rockham's got kind of what they call it, a cube or something. It's kind of their public, their station for public messages, kind of PSA, stuff like that. And I know City of Pittsburgh has been on there, whatever it is, Channel 6. And send it out to some of the stations, might play that, I don't know, for you. I don't really have a budget for that kind of stuff. But I get a lot of them that, kind of use that and, when I send out messages like that, or they'll call me and talk to me about it, and they'll make it into a little news piece, something like that. And we get here before we know it. There is a lot. I'll bet you get busy. I mean, and I'm glad, I know that there's just only a lot of things that are really important to make sure the public is aware of.
Because I know the health department's a big issue, right now, but then also like that census and everything too, the election, all
That's
of that stuff.
critical, that's
Yeah.
census too. People don't think about that. We'll be seeing our legislative districts, get revamped in 2022. That's usually when in 2012, we did it from 2010. And I mean, we don't want to lose, we're going to lose probably representation in this part of the state anyway, because we don't really guys fast. But we don't want to lose any more than we have to, that's for sure. I wonder if that sounded like that the lag or the lack of people responding is fairly stable. I mean, you can't have to lie.
It's like, I feel like there's just so many people that don't even know what it is.
Yeah.
Like even me, like I didn't really pay much attention to it, and I was reading last week, and it's like every kids is not counted for. It was like $2,000 or something per person. That's so much money.
Yeah.
You know.
You get into a few hundred or
Yeah.
several thousand.
Yes, especially for like the college students and stuff like that too. Because they really don't pay attention to it.
Yeah.
I know my boyfriend did it the other day. He was like, yeah, we get stuff in the mailers and shipping it, but he's like, I guess I'll give them the mail out the census. He's like, yeah, I just don't. I throw it away. And I'm like, no, it's way more important than you think. You really shouldn't do that.
They used to, and my mom did that a couple of times, where it was a census taker, where they would go door to door,
Oh, really?
basically.
I mean, that's almost like what you gotta do.
Yeah.
To get people to listen.
And it is, I mean, that you need to go door to door, the ones that you have a list of the ones that have no response from. And there are some changes, there probably are a few of those addresses that may not be habitable anymore, or may have a house going down or something like that, so that might change.
Yeah,
a little bit.
So the commission's going to go back into executive session for 15 minutes under non-elected personnel.
Pertaining to insubordination.
Two commissioners and council.
Right. I'll tell Julie,
My email, sgarrett@crawfordcountykansas.org.
Okay, that's what I thought it was. It has 2 R's and 2 T's?
Yes, and then Crawford County, Kansas, completely spelled out.
Yeah. something, well, they cleaned this up good.
Oh my goodness, I drove by the other day, I couldn't believe that tree.
Yeah.
Like, it's like a thunderstorm.
I tell you, they got after it.
Did you see all the pools down over my comment?
Yes.
That was crazy.
Yeah. My niece, our niece that she lives right there between 6th and 7th Street on Walnut in Pittsburgh. And she had a big chunk of a tree come down right against her back door, pretty much. It was actually, I'm surprised it didn't break the window going into where her dining table is right there. We went over there, Dylan, our youngest son, and I went over and cut up, we got it all chunked out of there and kind of hauled back to her back fence. We need to go back there and we'll probably load it in the truck and take it home. But, we wanted it so she could get in and out of the house anyway. So, she's gotta be her ex-husband. Ian's, 32. Her ex-husband teaches school in Pittsburgh. He's tested positive. And our kids have been over there to see that probably between when he was actually exposed and tested and stuff. So they're started quarantining. We didn't know that Saturday when we were over there. We found out Sunday, but we didn't talk to them. They just kind of waved out the window to us. I was thinking, that's really probably a good thing, Usually I go in and visit with, because we're really close with their kids. I guess 5 and 7. And it's hard to believe they're that old, but they call LaDonna and I kind of grandma and grandpa sometimes, but we now that we have our own grandkids, we're not over there as much, but we used to be over there a lot.
bringing the commission meeting back to order. Is there any other business?
I didn't know, that's why I was bringing this up, I had gotten, Sarah Runyon with City of Pittsburgh, their public information officer, had put together a video for me to promote voting by mail. And I was just, if you guys are interested, I'd like to put it on our website. And then some of the Facebook pages of the county, and then actually put it out to the media. But I thought you might want to see it.
Sure.
Prior to
Right.
anything like
Approving and it ends
putting it
up-
on
right.
the website. That was.
Oh.
I see nothing wrong with that.
That's awesome. Yeah, no, perfect.
Yep.
Anyway,
Yeah, let's blast that.
good, nice pit, nice production. Anyway, so I thought Samantha and I were talking while you guys were in executive session about trying to, especially with the ballot boxes going in, hopefully, we want to, we're not trying to tell people how to vote, which method they want to use, but we want to make it easy for them to vote from home if that's what they want to do, and promote that. So anyway,
Absolutely.
I'll use that. We'll start using that more and more as we sending it out to some of the media establishments. I'm not sure. Like I said, I maybe get some the TV stations to put it up there for free or something there for me or whatever, but it looks nice, and I think it's got a good message for us. So anyway, thank you. I just wanted to, while you were still here, I thought I'd run that by you while I was thinking about it.
Not a problem. All right, so for announcements, the courthouse in Girard is open to the public from 8 to 4 p.m. starting June 1st, 2020 until further notice. The motor vehicle office at the Judicial Center in Pittsburgh will remain closed, but residents may use the drop box at the security desk at the Judicial Center for motor vehicle and tax payments to be processed at the courthouse. September 7th, 2020, the courthouse will be closed in observance of the Labor Day holiday, and then September 8th, the commission meeting will be canceled, so our next meeting will be a week from this Friday. Is there any other business to come before the commission?
Mr. Vice Chair, if there's no further business, I will move we adjourn.
Second.
Oh.